please welcome the 57th governor of the great state of New York, Governor Kathy Hochul.
Hello. Good morning. Good morning. Buenos dias. Buenos dias. It's great to be back here in the Bronx. Oh, thank you. Thank you. All right. First stop after we announce our record-setting transformative budget. Where else would I go with the Bronx, right? Here we are. Here we are. And we are joined by so many outstanding leaders that you have here in the Bronx. And I want to just acknowledge some of them right now. You'll be hearing from your senadora, your new assembly member turned into a senator because of all of you, and that is Natalia Fernandez. Let's give her a big round of applause. Thank you. Our senator also from this region is Luis Sepulveda. Let's recognize him as well. Dear friend of mine who seems like she's been on the job a really long time, but it hasn't been much more than a year, is your Bronx Borough President, Vanessa Gibson. Let's give her a round of applause. Our Assembly member, Yudelka Tapia, my good friend, is where? Where's Yudelka? All right. Save her a seat. Save her a seat. Also, Marjorie Velasquez, our City Council member, has joined us. Our OMH Commissioner, Dr. Anne Marie Sullivan, is here. Dr. Sullivan. Our OAS Commissioner, Dr. Chinazo Cunningham, is here. Thank you. The Dean of the Albert Einstein School of Medicine, where we are today, thank you for hosting us, is Dr. Gordon Tomaselli. Dr. Tomaselli. And everybody knows Dr. Philip Oswald, our president of Montefiore, needs no introduction. Dr. Oswald. And you'll be hearing also from Yvette Brissette-Andre, the executive director of Unique People Services, about the services that she provides. Let's give her a round of applause. And I never forget the formers because, you know, they still gotta be recognized. You know, you never forget the contributions we had of our former Bronx Borough President, our great friend Ruben Diaz Jr. Thank you. And former Assembly member Marcos Crespo. Let's give them a round of applause as well. Here we are to talk about something that people haven't talked enough about, and that is mental health. In fact, the mental health crisis that too many New Yorkers are having to endure, and for far too long in silence. Today we break the silence. We say that their voices matter. And that's exactly what we talked about as we set forth our priorities for the state of New York in our budget just released less than 24 hours ago. Mental health will continue to be front and center because that is the core of wellness for our people, that they have the services they need if they're falling through the cracks, compassionate care, wraparound services, a place to stay and heal. And that, from this day forward, will be a priority of the state of New York because that's what our people deserve. And I wanted to make this statement of my values and our values as a society here in New York in the Bronx. I have been here many, many times. We were just here last month at the Bronx Children's Museum. And you think about what a wonderful, uplifting place for children to feel carefree and natural and sometimes get out of some really tough circumstances they may be going through at home. That's the beginning of good mental health for children. Nurturing places, caring places, letting them know they're loved. And for too long, there have been kids falling behind. And a lot of it happened because of the pandemic, but there was always this quiet underpinning of families not sure what to do with a child that seemed troubled, seemed to be more depressed, seemed to not get along with people, especially as they're growing into those really rough teenage years. As the first mother governor in the state of New York, I know all about those teenage years. I survived them. My kids will tell you how they fare, but I think they're doing okay. But I know how hard it is. I know how hard it is at a deeply personal level. There's nothing you want more than your kids to just be okay. And we're here to help. We're here to help, to say that that is a commitment from all of us in the state of New York. And so mental health has been a form of health care. We think about health care in a beautiful place. And this is an extraordinary place where we're educating the people who will be the ones who save our lives, save societies, help all of us recover from some whatever health challenges come our way. This is a place I want to talk about this because in the umbrella of health, we have to elevate mental health. And that is what we're doing here today. And this is an area that's been overlooked, underinvested in, and as I mentioned, the pandemic, what it did to people. And I saw this in my own young nieces and that senior year in high school, when you're supposed to be with your friends and going to proms and just feeling fun and like a kid again before you head off into the world, perhaps going to college, perhaps going to your job. And that was robbed from a lot of kids. And their younger siblings saw this. And the paralysis of just being so isolated, and all you have to connect you with the outside world is social media. And I don't think there's a single person other than those kids maybe who think that's a healthy outlet for them. So think about what happened for 2 solid years, compounding in a pre-existing problem, making it worse, and now 3 years later, we haven't regained our footing. We haven't solved the problem. And since the pandemic, more than 1 in 3 New Yorkers have sought mental health services or know someone who has. That's a lot of people. Many of them are young kids. But people find endless barriers. Even someone who steps up and says, I have a problem, my child has a problem, I'm ready to get help. Is it easy? They just make a phone call and there's somebody there? Gosh, no. They can't find appointments available. Insurance doesn't cover the services. There's long waits if they really need serious services and psychiatric beds. And again, I use the word disinvestment. I'm old enough to remember the 1970s when the decision was made that the best thing for people receiving care in institutions that they weren't a place of pride for a lot of us. They were not the place that people were getting all the support they need, but they're literally just, the doors were open and people were like, go ahead, you're on your own. Good luck to you. Survive on your own. And for me, at a personal level, my parents were very much social justice activists. They had us involved in everything. We always were either protesting the Vietnam War, marching in civil rights marches. My parents started a home for Puerto Rican kids whose parents were working in the fields. And they also saw that there was a place called the West Seneca Developmental Center, where hundreds, if not thousands of people, that's where they live. That was their home. And they were told they're going to be now out on the streets. So my parents joined a program where young people, in particular teenagers who'd be let out, 17, 18-year-olds, could at least spend time with families and learn how to do basic things. They'd never been in society. They didn't know how to go grocery shopping. They didn't know how to go to a drugstore and buy a tube of toothpaste. And yet they were going to be on their own. So I was probably 13, 14. My parents say, Roger and Melanie are going to come live with us for a while. You're going to take them into town, teach them how to shop, take them to the movie theater, just help them feel they're going to be okay. So that was my early exposure to what it was like when all these, I don't know how many Melanie and Rogers were out there getting all this support, but I bet a lot weren't. And they ended up on our streets. Many are still there, but they've been joined by so many more because society just turned their eye away and says, no, we're not going to look any longer. You're on your own. Except we are looking in the face of these individuals. Many of them are the people we see on our streets, in our subways, just trying to figure out how to survive with all the challenges going on that most of us don't have to endure. They're left on their own. And so it's become a public safety crisis in this sense. A mental health crisis has evolved into a public safety crisis, and fear has been generated because some of them really can't control their impulses. They need help. They need to be somewhere getting real help, not abandoned on our streets. So New Yorkers are anxious now about what's going on in the subways. It's a natural feeling. You feel this sense of compassion for someone, but you also know I can't let someone hurt my kids. I don't want to get hurt on my way to work. So there's this tension because New Yorkers have good hearts. They really do. They want to do the right thing. And so you see people unable to take care of themselves, who could harm themselves or harm others, who also are at risk of being victimized. So that's why I put mental health front and center. First issue I spoke about, now that the budget's been released, I talked about my state of the state, talked about it nonstop. Because the era of ignoring mental health needs is over. It is over. We are fundamentally rebuilding from the bottom up our continuum of care. Continuum of care means we take care of everybody in the mental health system. It's a monumental shift to make sure that no one else falls through the cracks. And that's why I can talk all day long, but people are going to say, show me the money. Show me the money. That's how we talk in the Bronx, right? Yeah, okay, a lot of talk, show me the money. I know the Bronx. That's why I was proud to announce a $1 billion commitment to improve access to mental health care here in the state of New York. And this is the most significant change since the deinstitutionalization of the 1970s. It starts with getting more patient beds, more psychiatric beds back online. Because right now we have 3,200 New Yorkers struggling with mental illness or addiction who are living on our streets and in the subways. At the same time we have the need going up, the number of psychiatric beds declined by 20% since 2014. Doesn't work. And as a result of bed reductions, a large number of beds also remain offline in our community hospitals. And there's also a lack of step-down services. I mean, someone comes in, okay, where are you gonna go afterward? Are you completely healed and all done? No, it doesn't work that way. Anybody knows it doesn't work that way. People need constant care, supervision until someday when they don't. So the lack of step-down services means occupancy rates. Sometimes people have to stay longer. They should be going somewhere. Some are being let out too soon. So people who are in severe psychological distress are increasingly more visible on our streets and are falling through what we call a broken system. So we can, and we must, and we will do better. Our plan is to add 1,000 inpatient beds by funding 150 beds at state facilities and bring 850 psych beds back online in hospitals. That's more than half the beds we lost since 2014 and will serve over 10,000 New Yorkers annually. And I wanted to come to this place because I want to give a special shout out to Montefiore. They never closed any of their 103 beds, 55 of which are in the Bronx, even at the height of the pandemic. And I thank you for that. I thank you, Dr. Oswald. I thank you. And even when times are tough, you said people still need care. And I share that philosophy. But we have to also go beyond patient beds. We're investing in transitional and longer-term supportive housing because that's a tool for prevention and recovery. We have to make sure that people don't get backed up in hospitals. When it's time to be able to go, they have to have a place to go. So our plan includes 3,500 residential units supported by intensive mental health services. That's how you help these people and make sure that people don't get left behind. So facilities that discharge high-risk individuals have to put them into intensive wraparound services, and we're going to help. The state will help you. We have to look after them. We have to check in on them. We have to connect them with resources, perhaps a job. Whatever they're going to need, we're going to have to give it to them, or else they cycle right back to where they started. That's what we have to stop from happening again. And we want to provide those services in the least restrictive setting. And so our plan expands outpatient services as well, assertive community treatment, safe option support, and intensive and sustained treatment and engagement. So that's what we're going to do. But how we're going to pay for it? Yes, we have our $1 billion, but I also think insurance companies should treat this as a health issue. So we are going to as part of my budget package, we are proposing legislation to ensure that insurance companies are prohibited from denying access to mental health services. That's because if you don't have insurance and you're supposed to pay for it out of your pocket, it's not going to happen. And cost and insurance barriers should never be a reason people don't get the help they need. Also, employment. Employment is an important part of the recovery process. My plan will expand individual support, connecting people to jobs and opportunities, job training, and help adults with mental illness find a job that makes them feel they have dignity, that their lives matter, that they're contributing, that they have value. Because right now, when they're laying on a street corner, they don't feel that. And my God, they're still God's children. And we can never forget that. And we have the power. All these services and the leadership team that I've assembled and all the people here, the elected leaders, community leaders, the providers, our doctors, nurses, we are all joined in this common pursuit of just doing what's right for these people. So giving them a job is so important. But what about the young ones who aren't old enough to have a job, the ones I talked about at the outset? Too many schools have no mental health support. In fact, in New York City, Comptroller's audit determined that 37% of schools in New York City have no services for mental health whatsoever. Now, I'd like to see the school that can say to me that not a single one of their students doesn't have a problem at all. They're all just doing just fine. I have yet to see that school. Until that time, I believe that our schools are also part of this continuum of care, because that's where kids are going to spend most of their day. That's where they're going to have adults who are trained to know when something's not quite right, and they need mental health services. And this kids who don't get help, it puts them at a disadvantage in the classroom and beyond, and it sets them up for failure. So our children need preventative services now to stop them from needing intensive services later. That's why we do this preemptively. And we will make sure that we stop ignoring this, because we know teenage emergency rooms visits are way up. There's been a 40% increase in the last few years of teens reporting just sadness and depression. Again, I have a lot of young people in my family. I observe everybody. And I'm not going to just blame social media, but I'm so glad my kids weren't exposed to that, because you just don't feel good. You're always being compared to others, and you always have this sense of inferiority that adults weren't subjected to. Yeah, there's bullying around everybody, but this is sustained. When that is your connection to the rest of the world, and that pervasive negativity just eats at your soul and you don't feel you have value, we have to counter that. Parents need to know that's what's going on in their houses. So we got to help these kids too. You know, a teenager, think about a teenager starting off as a sophomore in high school, having to finish remotely, finishing middle school remotely. A lot of them have anxiety. They need these services. And that's why I'm investing money into the systems, $10 million to expand school-based mental health services across the state. Thank you. And $10 million to strengthen suicide prevention programs for at-risk youth. We'll also have $12 million in what we call the Healthy Steps program and home-based crisis intervention teams to go out where the kids are. And my goal is to reduce the unmet mental health needs of our children by half in the next 5 years. That's ambitious. That's bold, but we have no choice. And you think about the ripple effects of all this anxiety, depression, deaths from overdose drugs rose 58% from 2018 to 2021. And I've been studying this a long time, probably 15 years. When I was back, actually longer, when I was back on my town board, local council member. We started seeing teenagers overdosing from heroin in my hometown. And everybody's like, where's this coming from? And where'd the addiction start? Well, a lot of it was prescribed by a doctor at the time. I remember my kids were in middle school when this was going on, and both my kids had their wisdom teeth out, and they're given a 60-day supply of hydrocodone to deal with one-day surgery on their mouth. I knew about the danger of this because I was already seeing the police data in my town of the overdoses. So I didn't feel very, they thought it was kind of heartless when I said, take an aspirin and suck it up, you'll be fine. But a lot of parents didn't know this. And my own nephew had a workplace injury as a teenager, working at a delicatessen, cut his hand. And they prescribed the drugs to make him feel better, get over the pain. But after 17 days, your brain chemistry changes and addiction starts to develop. That happened to my nephew, led to a decade of in and out, services, can't find services, jail. The stress on the family was immeasurable, and that's just one family out of millions. So I know what this can do. This way, opioid addiction and also now fentanyl can literally grab you by the throat and strangle you. It doesn't let you go. So we're going to work with our state and federal partners, with our local partners. We have to stop the flow of these drugs from coming into our state, but we also have to deal with the impact of the addiction that exists now. And this is something we are laser focused on. We're going to keep focusing on life-saving initiatives, expanding access to critical harm reduction tools like fentanyl test strips, literally allowing people to come in to a facility and have it tested whether or not the drug they want to use is laced with fentanyl. Now, that seems pretty extreme, but I believe it'll save lives. I believe we have to take that step to let them test. We have to spend the money, get the test kits out, make sure that that happens. And I'm going to have a new interagency task force to examine every aspect of this. So we're going to be transformative in the mental health space, also $1 billion, and not the same, another $1 billion for the healthcare system overall to help with capital funding, because we have to continue to help our hospitals expand, grow, meet the needs they have to. Expand Medicaid coverage for 7.7 million more low-income New Yorkers, increase more access to aging services for our seniors and long-term care, and all this because we care about our people. It's that simple. I don't need a big flashy slogan. We just care about people because that's who we are as New Yorkers. We've always had that in our hearts. That's why the rest of the nation looks to us for all of our policies. What is New York doing? They always do it best. They're so smart, they're so innovative, and they're so compassionate. And that's what this is all about. Am I bragging like a New Yorker? That's okay. I think a really smart guy like Albert Einstein would agree with what I just said too. So thank you. Thank you for being part of our team, people who do care. And all of you have a different role to play. I know my role. All of you have a role to play to help lift up our people. So when our time on this earth is over, when people say, maybe the maker's going to say to you, what did you do? Did you make a difference? Did you make someone's life just a little bit better because of what you did? I believe that every single person in this room will be able to answer with a resounding yes. Yes, because I cared and I made a difference. That's how I judge myself. That's how I expect to be judged. And today we're going forth to show some of our most vulnerable residents that we care. Thank you very much. And with that, thank you. Thank you. Thank you. Let me bring up, thank you. Thank you. Thank you. Let me bring up our extraordinary Senator, Natalia Fernandez.
Thank you so much, Governor Kathy Hochul. This announcement is probably the biggest that I've seen and heard in my career in public service. So please, another round of applause for Kathy for coming to the Bronx for that. Thank you. I am Natalia Fernandez, your local senator right here in this part of the Bronx. Thank you. And I think it's so beautiful that you came right here to Morris Park in the heart of where we have our public health systems, Montefiore, Bronx Psychiatric Center. We are a hub right here, and we have been fighting this fight with our community, our loved ones, with the system that for a long time has not recognized us, that has not funded the need for mental health services, for wraparound services, for housing services, for substance abuse services. And I truly thank you, Governor, because for the first time in a long time, you have heard us, you have seen the problem, and you are delivering. $1 billion? I cannot believe. I cannot believe. But I look forward to working closely with you in the next couple weeks as we go through the budget to make sure that every dollar is being utilized for its best purpose, that every dollar is being serviced to a child, a senior, an individual, an adult that needs the services. And I have to highlight the care for our children, because for a long time, from the beginning, before the pandemic, to during the pandemic, and now as we're getting through, we've seen more and more that our children need help. Our children have been traumatized by what's been happening in this world around them, more so even than what's been happening in their communities, because our communities have suffered in different ways that affect our children and their ability to really grow and thrive in their neighborhood, in their classroom. So that investment is huge, and I thank you so much, Governor. Thank you. But the work continues. We will comb through that budget to make sure that there is a good connection to where the help is needed and that the money is delivered. And as the chair of alcohol and substance abuse in the state Senate, I look forward to making sure that we can bring those connections to helping our most vulnerable, those that are suffering with addiction, those that are suffering with mental health, to get them the proper help that they need. So, Governor, thank you. And with that, I'm going to introduce my friend and colleague, Senator Luis Sepulveda.
Good morning. Buenos días. Assalamu alaikum. Namaste. Greetings to everyone. You know, God works in mysterious ways. I want to take you back to 1975, where you didn't have the kinds of funds or services for mental health that you have today. My mother came to New York at a very young age from a small town called Guanica, Puerto Rico. As I discovered later on, to my family members, my mother suffered from depression. And on numerous occasions, she attempted to take her life. In 1975, she succeeded. I was 11 years old. And when we talk about suicide and mental health, it's not just the person who takes their lives, but the families and the impact on the families. I was a young boy, 11 years old. My mother was 33 years old. She had 4 children. And when she took her life, we were left without a mother. And a lot of things happen when it happens to a child. Now, I promise, after seeing my mother in a coffin as a young boy, that if I ever got the opportunity to bring to light the issue of mental illness, and whatever I can do to spread the word about the need for mental health services and funding, that I would do that. And here I am today, almost 60 years old, speaking after our great governor, in the great state of New York has made an announcement about $1 billion for mental health services. Now, I know that if we had these services then, if the stigma that seems to evaporate now on the issue of mental illness has somewhat dissipated, that my mom would be alive today. So I am extremely grateful to the governor, not only for this, but other things that she has done in her budget and the state. Extremely grateful for her commitment in the budget, because remember that budgets are an indicator of our priorities. But I leave you with this. The number 2 killer of young Latina girls 11 to 19 years old is suicide. The number 2 or 1 killer of young African American boys younger than 8 years old is suicide. Unfortunately, when we're young and we suffer from mental illness, there's really no way of ascertaining exactly what is wrong with a 6, 7, 8-year-old child. And by the time we discover that that child is suffering from mental illness, sometimes it's just too late. And I know that these funds are going to make a big dent on those numbers. I also leave you with this. If you look at our incarceration facilities, in some cases, more than 40% of those that are incarcerated are suffering from mental illness. How do we expect a person suffering from mental illness to get better in an incarceration facility? So these are the services that we need when they are back in the general population, with families. Because I know that these are the services, this is the kind of investment that's going to make an incredible difference to people in my community who are suffering from mental illness, people throughout the state that are suffering from mental illness. Thank you for listening to my words. I am honored that I've been able to keep a promise to my mother and my family that I will scream for the bleachers about the need for mental health services. Y para rápido, para la prensa en español, estoy orgulloso de estar aquí hablando sobre el problema de salud mental aquí en el estado de Nueva York. La comunidad de Nueva York, el estado de Nueva York, los residentes de Nueva York deben de estar muy agradecidos que la gobernadora ha dedicado $1 billón para combatir el problema de salud mental. Así que vamos a dar las gracias a la gobernadora. Si le ven una oportunidad, tiene un familiar que esté sufriendo de salud mental, denle un abrazo a la gobernadora por dar y poner $1 billón para combatir este problema en el estado de Nueva York. Muchas gracias, que Dios los bendiga. And now I have the honor of introducing someone who really doesn't need an introduction. She's one of the hardest working elected officials I've met in my life. We have a competition. But she has a bigger venue now, so she's beating me. But please help me welcome our Borough President, Vanessa Gibson.
Good morning, ladies and gentlemen. One more round of applause for our State Senator, Louis Sepulveda. Today is a great day for our state, for our city, and certainly for the great borough of the Bronx. Today, we join our distinguished governor, Kathy Hochul, in reaffirming our commitment to the continuum of mental health services for every New Yorker across this state. I am honored to stand before you as the 14th Bronx Borough President. I say thank you all for joining us today, to our governor and your team, to our distinguished leaders at Einstein and Montefiore, to my predecessor, number 13, Ruben Diaz Jr., to all of my colleagues in government, and to all of our trusted partners, healthcare advocates, champions for our borough, and credible messengers. We are so grateful that our governor has chosen the great borough of the Bronx to announce a $1 billion commitment for mental health services for all New Yorkers. Now, before I talk specifically about mental health services, I want to acknowledge the incredible commitment of our governor. Just in the last several weeks, we have broken ground on the new Metro North stations that are coming to the East Bronx a few weeks ago. We were in the South Bronx as we celebrated the Bronx Children's Museum, the first ever children's museum in our great borough, as the governor made an announcement about universal and affordable child care, which we know is important. And now here we are in February as we talk about mental health services for every New Yorker. This plan is a robust plan. It is a comprehensive plan that will not only recognize the importance of mental health services, but do its part to remove the stigma that so many New Yorkers face each and every day. It should not be a crime to acknowledge that we are not okay. It should not be a crime to acknowledge that we need help, that we have simply been traumatized by every pandemic that we have faced, from COVID-19 to the trauma of gun violence and street violence, to lack of opportunities and poverty, so many things that have affected us deeply right here in the Bronx. We saw during COVID-19, so many New Yorkers struggled for basic necessities like affordable and low-cost and accessible health care, healthy food options, a stable roof over their heads. We saw many of our older adults living in social isolation. It was a real challenge for us here in the Bronx. But what I saw was the resilience of our borough. I saw the strength. I saw many of our residents turn pain into purpose and turn their storm into strength. This $1 billion commitment across the state of New York will be transformative. It will be a game changer. It is historic. 3,500 new units of transitional housing, supportive housing, step-down units of housing, behavioral health. My personal favorite, the recognition of school-based health clinics and mental health counselors. Every school in our state should have a licensed and full-time mental health counselor, a guidance counselor, social worker, and a school nurse. And we have to get to that point where it's universal across the great state of New York. And so I am proud as the Bronx Borough President to work hand in hand, shoulder to shoulder with our governor, with our state senators, with our state assembly members, members of the New York City Council, all of our trusted partners, adding on more Article 31 mental health behavioral clinics, making sure that we focus on children's mental health, because so many children are traumatized by life and they need the assistance. That's where the school-based health clinics come in, the wraparound services, the trauma-informed care that will simply make a difference. We have an opportunity and an obligation and a responsibility as government to allow people to get health equity and health justice. That's what I call it, because it's an injustice when we deny and close doors of opportunity for New Yorkers to access mental health services. And yes, we must remove the stigma, because far too many New Yorkers do not feel comfortable coming forward, do not want to acknowledge that they need help, do not want to admit that they could be a victim of their circumstance, but we know they can be a victor of their circumstance. They can go on to live productive and fruitful lives if they have those wraparound and comprehensive services. So this plan is really going to make a difference. And I'm so grateful that of all the places the governor could have chosen to be, she's right here in our borough, working with Montefiore and Einstein. And so I celebrate this day. And I know that it's not easy for anyone to acknowledge that they may need help. But if we could be the source of encouragement, the source of support, if we can give people the trusted work and the partnerships that we know they rightfully deserve in an equitable fashion, with an equity lens, turning no one away, no matter where they live, no matter what zip code they reside in, and allowing them to get the basic health care and mental health services, addiction treatment, substance abuse treatment services that they deserve, they will go on to become productive leaders of our great state. And so I thank you, Governor, so much. I thank you once again for choosing to be here and to work with us. You are a friend to our borough, and we are so grateful for you. So with that, I am excited to recognize a great, credible messenger, trusted partner, executive director of our very own Unique People Services. Please help me welcome Yvette Brissett Andre. Congratulations. God bless you. Thank you. Thank you.
I stand before you this morning deeply humbled. I am blessed to be chosen to talk about a nonprofit, a community-based organization, and the impact that the governor's $1 million in mental health will have on us that work in the community and provide services. I am deeply honored to follow our great borough president, Vanessa. That was a beautiful speech. Now, who is Unique People Services? Unique People Services is an organization that was founded in 1991, and we have been providing services to the needs of vulnerable New Yorkers for 3 decades. Our mission was established in 1991, and it remains very present in today's environment. It is to serve holistically without judgment those who may have been denied compassionate care, treatment elsewhere due to their race, their religion, their gender, their sexual orientation, developmental levels, health status, criminal or substance abuse history. In the governor's inauguration speech of 2023, where she eloquently spoke about and stated that when it comes to New Yorkers' well-being, strengthening our mental health is a priority. And she has demonstrated that in the budget by providing $1 million. Our governor's words resonated with me as an individual. It not only resonated with me as an individual, but as a community-based organizer. Her words are innovative. Her words of innovation give hope to vulnerable New Yorkers that seek and require mental health care, continuum of care, from prevention to treatment to recovery. It also amplified what Unique People Services as an agency, as an organization, does on a daily basis. And that is to serve the population and to provide a continuum of care that unites in service delivery, supportive, relevant, and purposeful for individuals with unique challenges. As a practitioner, I am aware of the need for the increase in operational capacity for inpatient psychiatric treatment. The establishment of systematic accountabilities and expanding insurance coverage for mental health service is greatly needed. And we are thankful to our governor for her crucial investment in mental health resources. This investment includes permanent support housing. Housing is our basic need. Affordable housing also tied with crucial wraparound and community-based support, is truly the secret sauce for success for our tenants and their ability to realize their full potential and strive in the community they call home. In a report published by the Coalition for Behavioral Health that magnified what happened during the pandemic, COVID-19, it states that New Yorker experienced mental illness more than tripled during the pandemic. Addressing this, Governor, is part of your plan, and this is transformative, and we say thank you. Additionally, the pandemic also amplified the need for the healthcare workforce. In real time, many organizations sitting in this audience tonight, like mine and others, can speak about the experience of workforce crisis that we're experiencing now. Behavioral health providers are needed more than ever before. A need for service and operation capacity is an important part of your plan, Governor. You have demonstrated that through the workforce investment that you provided to us, that health and behavioral health workforces will be covered last year and going forward. And for that, we say thank you. New York State investment and significant policy change are crucial in meeting mental health need. That is why the Governor's transformative plan is exactly what our community needed and as asked for many, many years. We have been serving New York most neediest at a fragile rate, and we wanted to say thank you, Governor, for meeting the gap. Thank you. Now, how does that work with my agency? Let me tell you about it. Unique People Services is building a 96 mixed-use housing that also provide housing for individuals with mental illness. The address is 2050 Grand Concourse. It's located in the Mount Avon section of the Bronx in Community Board 5. And we're thankful to partner with the community. As a nonprofit, you can't just go into the community and provide services. You have to work with the community board, know the needs of the organization, and plan accordingly. While I was in the back, I was talking to our borough president, and oftentimes communities are afraid, NIMBYism come into play, not in my neighborhood. Then she spoke about the housing that we're building and that they're not large enough for some of the families. And I talked to her about the program that I built. I take into consideration those needs, and I make sure that 2050, yes, it's short because yes, we did get HBD and HHAP funding, state and city funded, but we have community facility, a garden in the facility that families can come together and socialize. And that is the Governor plan aimed to do. It aims to create housing unit for individuals with mental illness. Our 2050 Grand Concourse development is a positive transformation to the life of individuals and family. It is a place where residents can call home. Now, everyone sitting here today know that your basic need is home and food on your table and quality housing. It is a place that not only provide quality housing, but it provides services. Our individuals will have supported services, and they will provide a comprehensive care and make a difference in the lives of those who will be living in 2050. People with mental illness are everyday individuals. They're your neighbors, they're your pastors, they're your children. And we have seen the impact that this had on our state of New York during the pandemic. And we're thankful that our governor recognized this and has provided aid to meet our needs. This has been long overdue. Our system has been fragile for years. The Office of Mental Health, Commissioner Ann Sullivan, is sitting right there, and she is a dedicated woman. If you work with her, you know that this is not a job for her, it is a calling. Through the governor, her calling can be a reality. She has been provided additional funding to make this a reality. We all are strengthened by the support and the direction of this governor. As she provided more than hope, but a real plan for the future, one that supports the life-saving work that organizations like Unique People Services do, and the importance of transformation starts with all the elected officials that are sitting here today, right? But each of us also have the power to make a change. And with the governor budget, we're all electrified in making that change. And we thank you, Governor Hochul. Thank you.